thicknesses of tissue, the photons are attenuated differentially. The result is that structures deep in the body are reconstructed as having falsely low tracer uptake. Contemporary scanners can estimate attenuation using integrated X-ray CT equipment, in place of earlier equipment that offered a crude form of CT using a gamma ray, positron-emitting, source and the PET detectors. While attenuation-corrected images are generally more faithful representations, the correction process is itself susceptible to significant artifacts. As a result, both corrected and uncorrected images are always reconstructed and read together. 2D/3D reconstruction. Early PET scanners had only a single ring of detectors, hence the acquisition of data and subsequent reconstruction was restricted to a single transverse plane. More modern scanners now include multiple rings, essentially forming a cylinder of detectors. There are two approaches to reconstructing data from such a scanner. 1. Treat each ring as a separate entity, so that only coincidences within a ring are detected. The image from each ring can then be reconstructed individually, 2D reconstruction, or 2. Allow coincidences to be detected between rings as well as within rings, then reconstruct the entire volume together, 3D. 3D techniques have better sensitivity, because more coincidences are detected and used, and therefore less noise, but are more sensitive to the effects of scatter and random coincidences, as well as requiring correspondingly greater computer resources. The advent of sub-nanosecond timing resolution detectors affords better random coincidence rejection, thus favoring 3D image reconstruction. Time of flight, TOF, PET, for modern systems with a higher time resolution, roughly 3 nanoseconds, a technique called time of flight is used to improve the overall performance. Time of flight PET makes use of very fast gamma ray detectors and data processing system which can more precisely decide the difference in time between the detection of the two photons. Although it is technically impossible to localize the point of origin of the annihilation event exactly, currently within 10 centimeters, thus image reconstruction is still needed. TOF technique gives a remarkable improvement in image quality, especially signal-to-noise ratio. Combination of PET with CT or MRI. Main articles, PET CT and PET MRI. Complete body PET CT fusion image. Brain PET MRI fusion image. PET scans are increasingly read alongside CT or magnetic resonance imaging, MRI, scans, with the combination, called CO registration, giving both anatomic and metabolic information, i.e., what the structure is, and what it is doing biochemically. Because PET imaging is most useful in combination with anatomical imaging, such as CT, modern PET scanners are now available with integrated high-end multi-detector row CT scanners, so-called PET-CT. Because the two scans can be performed in immediate sequence during the same session, with the patient not changing position between the two types of scans, the two thicknesses of tissue, the photons are attenuated differentially. The result is that structures deep in the body are reconstructed as having falsely low tracer uptake.